I got diagnosed, I thought that HIV or AIDS was what society said it was, a disease that was meant for people who didn't fit into the stereotype or heterosexual motto, to get rid of those people from the face of the earth. Because in biblical days, there was supposedly an abomination or a sin. Didn't really agree with it, and I still don't today. But at that time, that's what I thought. So for a while, I was just in that denial and trying to avoid it. Turned into a workaholic. That was in school at the time, and I was like, why now? Why now? When I'm trying to do something better, do something different. And so when I actually did go to the health department, within that 2-week span of time, I had developed double pneumonia, was having night sweats, fevers, nausea, fatigue, to the point, and I was like, my body was just wasting away, and I really couldn't put it off any longer. So I went to the hospital and went to the ER. They had me sitting down there for 6 to 8 hours, and they just took me upstairs. They didn't tell me what was going on, what I had, although in the back of my mind I knew. And it was really tough. It was extremely tough because my family was there and they were supportive, but I was so sick that they really couldn't come sit vigil with me because at the time, my CD4 count was less than 20. So I was pretty much on my deathbed. I think there was a lot of fear going on about it, and people didn't really understand exactly what HIV or AIDS was because the representation had totally changed. It had kind of lost that true ailment phase because medications are so much stronger. And after, a month or so, and, I was still angry at my higher power or my creator. Why would you have to give me this? The stigmas that are attached to people being HIV positive is that a lot of service agencies, hospitals, doctors' offices, they treat people maybe less than a normal person. That makes any sense. It seems rather unfortunate that how they have things set up, they basically force you to go on disability, and then they look down at you because you took the help. So if you have, if you're fortunate enough to get Medicaid, Medicare, and get your medications, now you have to deal with a snappy nurse or whatever, or overbogged down doctor that's not really hearing you, not hearing what your ailments are and giving you the proper medical care that you need. So that, and in the dating scene, it's a big problem because a lot of people aren't willing to put their status out there like that. They'd rather, well, I'll wait. Well, my policy now is honesty first, because that way I'd rather you disappoint me now that I haven't invested the time, energy, or effort than to wait a month, 2 months, 3 months when now I've got feelings invested and then tell you and have the fear of rejection then. I think a lot of people misunderstand that HIV is just like cancer, it's just like diabetes, it's just a disease that affects the blood, that happens to affect the immune system. And we aren't bad people trying to get well. We're just human. We take our medication, we pay taxes, we deserve to be here just like they deserve to be here. We're worthy just like they're worthy. To someone who cares about someone in their family, if they have someone that's going through something, you have no idea what truly that person's going through. Make their day a little easier, make their week a little easier. You know, show your support. It's not, you can't get HIV from a kiss, a hug, sharing a drink, or anything. It's not that kind of disease, you know? We're just human, just like you.